Well, all right, we're here with Dr. Shannon, dentist in Northridge. Hi, Dr. Shannon, how are you doing?
Hi, good. How are you, Helmut?
Very good. Dr. Shannon, you told me that you talked about bleaching teeth, whitening teeth, basically getting nice, bright, whitey, shiny teeth. And there are lots of ways of doing that, from sticking on a strip to all kinds of things, $10 remedies in the supermarket, and they all seem to have some value. There is, however, also something new out there, completely new, relatively new, and tell us about it. Tell us how you go about it, tell us what you have, and tell us what the development of teeth whitening, how far it has come.
Okay, well, thanks. I'm glad you brought that up because it is amazing. It's something that a lot of dentists aren't even doing yet because it is so cutting edge. But, of course, the research has been there and the universities have been doing it, and it's certainly very safe. It's not like it's something new that we're experimenting with, but it's really amazing, and it's actually laser tooth whitening. It's a whole new use for these new diode lasers, and the results are unbelievable. It's just a whole new game out there that puts everything else to shame. I mean, there's no comparison with the ease for the patient. It's very gentle on the teeth. It actually can take sensitive teeth that are sensitive to hot and cold and sugar, sweets and things like that. And it can actually take those teeth and desensitize them. It makes them healthy so that they don't have these symptoms anymore. So people that get their teeth whitened with the laser, as a side effect, besides having great white teeth, they now have teeth that aren't sensitive to hot and cold and sweets. And it's amazing. The results are great.
Interesting. So tell me, so laser. So are you telling me that this is something different than this Zoom White or whatever it's called?
Yeah, Zoom White.
It's been around for a decade or something like that now.
Yes, correct. Now, we were using Zoom in our office. That used to be the latest and the greatest. And basically what that is it's a light that you use. You place the material on the teeth, and the light activates the material and makes it work, makes it whiten the teeth. But one of the side effects of that is it has a tendency to dry the teeth a little bit from using the bright light on it, just like a bright light in the movie business will make people, skin feel dry. They have to put makeup on and stuff. So what happens is the teeth from that dryness can become sensitive for a little while, even if they weren't before. This is totally eliminated with the laser because the amount of time that the lasers put on the tooth is very little compared to the full hour of constant light that you get with the Zoom. This is basically seconds of laser contact, and then after that, there's no more light, there's no more trauma to the tooth. So it's much different than the Zoom was.
I got it. So, are you telling me that the visit to do your teeth whitening with the laser is a lot shorter than with the Zoom machine?
Yes, it is. There's a certain amount of prep time that you have in the Zoom, and there's a certain amount of prep time that you have, isolating with the laser as well, where you want to, kind of keep the lips out of the way and the tongue out of the way. So you have the same amount of prep time. That's the same. But with the Zoom, you have 4 treatments of 15 minutes each. So you're sitting there for a full hour where you can't move. You have to be careful. It's a long, process. But an hour, again, it was still quite a jump forward in the technology. It's not really that terrible, but in the world today, an hour, it seems like, 4 weeks to most people. They have no time, The laser, you're looking at 20 minutes of total time, and you're only looking at about 3 minutes of the actual light that's on the teeth. So once the light goes off, the person feels comfortable not having that brightness. They don't have to wear, protection, and they can watch TV while they're sitting there. It's a lot different. You're not worried about that bright light shining in your eyes.
Interesting. And the results are immediately? Basically, he walks out with bright white teeth?
Immediately, yes. We've seen, not in the literature, but in my office, we've seen people that have come in with teeth that they've actually been told that they can't whiten. They won't whiten because of different chemicals that they had taken, different medications they might have taken when they were younger, or a certain kind of water they were drinking where they lived in a certain place growing up, and they only had one choice. They couldn't whiten their teeth at all. They would have to put caps, or they'd have to put veneers on their teeth to change the color. And we've actually seen those colors brighten 8 and 9 color steps on the scale, and there's only 14 colors. If you're the darkest tooth, the most you could brighten would be 14. And with these people, we've seen 8 and 9 steps. So it's really amazing. It really is. It's just you have to see the pictures of it to really believe that you could get that kind of results in such a short period of time.
Right, and so I assume you can also control it, because not necessarily everybody wants to have super white. Somebody wants just a shade off, 2 shades off. Can you control that?
Yes, good point. Again, you do it in increments. So you look at it, and if the results are where you want them to be, then you're done. If the results aren't where you want them to be, then you put the light back on it and you hit it up a second time. So, yes, it's definitely controllable. You can go anywhere from 1 to 4 treatments on it. And the 4 will take you from, brown to white, and the 1 will take you from dark white to light white, so to speak. So you've got a lot of control in there. So
good news for smokers, huh?
Absolutely. Good news for smokers and people that love their red wines.
Oh, is that so? Red wines?
Yes, people that drink red wine. Yes. You see, so there's hope for everybody, whatever the person's situation is.
What about coffee? I like my
coffee.
Espressos.
Absolutely, coffee, tea. People like their dark English black teas. All of that is a whole different look now. Yeah. And it can be done if you, we have a couple of people that have been in some commercials and some, artwork type of things, and they've actually come back in, and after a month they've had their wines, and they've had their cigars, and they've had their, coffee, or what else, a whole list of things, and it didn't matter, and then after a month we just do it again. And then they can go out and they can shoot and do, a new commercial, and, it's great. So it's not like you do it once and you can never do it again, or you have to wait a certain amount of time. You can come back in and change your mind and say, yeah, I want them whiter. So, okay, fine. The next week we'll whiten up some more.
Good. But the average person who isn't, number one, smoking, drinking, and like a sloth, and isn't necessarily an actor, an actress, and not that sensitive, he doesn't have to come back every month or so, no?
No. You can do it, and the work that's been done, and this would be more of the research that's been done because it's a longer period of time. The color will hold up for 3, 4, 5 years without any problem whatsoever. It depends on the age of the person too. Unfortunately, we hate to admit it, but as we get older, our hair gets whiter, but unfortunately, our teeth get darker. So it depends on what phase of life you're in as well, because as you're older, your teeth will darken faster, just as your hair will lighten faster. But I guess that's another story right there.
I think that's another story. Well, very enlightening, very interesting. I'm sure there's lots of people out there who, you're right, Dr. Shannon. We live in a world of instant gratification. If I send you an email and you don't get it 16 seconds later, one gets frustrated. So definitely right, wrong, it doesn't really matter. It's what it is. People wanting to run around with a tray in their mouth and every night. It looks innocent at the beginning. Doing it, a whole different ballgame.
Well, you are correct there. Nobody can do it for 2 weeks straight without missing a night for some reason. And, that's what happens. One night, then you miss another, then you miss another, then you don't take it out anymore, and you go, oh, whitening doesn't work, But it absolutely does. For millions of people, it works great.
Beautiful. Thanks, Dr. Shannon.